to God, indivisible, with liberty and justice for all. Thank you very much. You may be seated. I'm scanning the audience. I don't see any guests. So we'll go straight to announcements. Cup money, I always want to remind you to do that. When I forget to do that, the amount seems to go down quite a bit. I mentioned this last week, but I'll mention it again. You should receive 2 emails every week. One coming from Marie for the invitation to the weekly meeting, and one from me, my weekly email, which is usually on the Wednesday, the day before our meeting. Yeah, well, that's right. 3 emails per week, and one of them is from Steve, where he's sending out the Zoom link, and that usually goes out on Monday, I think. So anyway, if you do not get those, check your spam folder, please. Still time, and actually we're nearing the end of the Rotary year. If you're doing volunteer work, even if it's not Rotary related, please get in touch with Jeanette Weens. Her email address was in my email yesterday. You can report your hours of service. We are still working on a Zoom team, and as I mentioned last week, somebody helping Steve on Zoom does not necessarily have to be present at the meeting. So those of you who are regular Zoomers, we would welcome your help. I mentioned it yesterday. One of our presidential citation goals is to have actually 5 members participate in some sort of leadership training. Most typically is the Kansas Leadership Center, which was all virtual this year. When we set the goal, that was it was in the middle of COVID, but we didn't think it would stretch so long. So I know the opportunity for that training has not been as available as in the past. But if you have had any kind of leadership training, please report it to me so we can factor that into the presidential citation. Our next Rotary Rubbish Roundup will be at the Seward Boat Ramp. That's on Saturday morning, the 12th. Yes, and Steve's going to make something else here.
Sorry, the announcement that I want to make is that I went by the boat ramp on my way in this morning, and there is a grocery bag or less of trash at the boat ramp. So I think we'll meet there and probably come into the Pocket Park and finish up. But I have emails into Dawn Bueller to find out if there's anything else we can do, landscaping or whatever, to adopt that boat ramp. But I think it would be good for us all to see it. We're going to be there at least every quarter. So let's start there. If you don't know where Seward is, or you're coming from the north or south on the Oakland Expressway, there's a Seward Street exit. Just take that exit and head east. And just as you come to that first turn that's turning to the south, look off to your left, because there's no marking, but that's where the boat ramp is. You can't see the boat ramp, but that's where it is.
Great, thank you, Steve. Our speaker today is Dr. Erin Locke, who is the health officer for Shawnee County. She started that position, I think, February 1 of this year. She previously served as a family physician in Holton at the Holton Community Hospital. She completed her medical degree with highest honors and a master's in public health, both from the University of Kansas School of Medicine. Dr. Locke holds the following licensures and certifications: American Board of Family Medicine, Kansas State Medical License, DEA Controlled Substance Registration Certificate, Pediatric Advanced Life Support, Advanced Cardiac Life Support, Advanced Trauma Life Support. I think I got them all. Well, but we're going to find out what she does do here in a moment. Dr. Locke, please take the podium.
Thank you. All right, so first challenge is to get the PowerPoint. Is that working? Okay. Aha, there it is. Perfect.
Thank you, sir.
Thank you. And yes, thank you so much for inviting me to speak today. I am just going to do a sort of brief overview of the state of public health here in Shawnee County. It will, of course, not cover everything. But I'm going to start just by talking about what public health really is and what the health officer's position actually means here. And then we'll we'll move into the social determinants of health, which will be a nice segue into our community health improvement plan. And then we'll just briefly touch on COVID at the end. So what is public health? Public health is an entire field of science that's dedicated to protecting our health. And it's not just protecting our health from disease, but it's also about promoting us to have our best lives. And really, like, when public health is working, it's often unseen, it's in the background, at least before the pandemic started, and then it really jumped into the forefront. We are very much concerned about health equity and quality of life, and not just disease prevention. So here in Kansas, public health at the local level has really been around for well over a century. In fact, the first Kansas statute was in 1885. And it was at that time that the county commissioners were named as the Board of Health. But most commissioners don't have a medical background. And so the same statute allows them to appoint a health officer to sort of act on their behalf. And the health officer works in conjunction with the health department, but is actually outside of the health department hierarchy. I think over the last year, we've all become pretty familiar with isolation and quarantine and health orders. And so I'm just labeling the statutes here that provide that authority. So there's legal authority for the health officer written into the Kansas statutes that allows those decisions to be made. But those are arguably the least fun activities that a health officer would do. And so what I actually am very, very much looking forward to is working to identify our health priorities for our community, and then to really help establish the policies and advance health equity here in the county. Now, I mentioned the health department. The health department is also a part of the county governance, and so they answer to the commissioners, much like Parks and Rec, solid waste, the county jail. Those are all departments within the county. And our director is Teresa Fisher, who just took on that role in the last few months. She previously was a division manager for family health. And within the health department, there are 5 divisions, which each of them holds quite a number of tasks, you might say, or programs and projects. But a couple that you might be familiar with would be the WIC program that's administered by the Family Health Division, and our vaccines program, which is administered by Clinical Services. Okay. So much of public health and what public health means is actually captured in a parable about working upstream. And you may all be familiar with the parable, but I'll just summarize it briefly. You can imagine a woman, she's out walking along the river and she's just enjoying the day. But there's somebody who's fallen in the river and she needs to jump in and pull them out. She feels good about that. You know, she saved a life. But she continues her walk. And there's another person in the river. She has to jump in again and pull them out. And then again and again and again, all these people who are in the river. So she's a smart person. She thinks to herself, why are people falling in the river? And so she turns around, she heads upstream, and she finds a beautiful overlook, lots of tourists, lots of cameras. People can enjoy the overlook, but they continuously slip and fall into the river and float downstream, and she has to pull them out. So she, again, smart person, figures out that we need a barrier, and she advocates for that. She goes to the proper authorities, a barrier is put in place. People are no longer falling in the river, and she no longer has to fish them out downstream. So that's the idea in many ways of what public health is doing. It is preventing your problems from ever happening, encouraging people to enjoy their overlook without the consequences. And so another way of talking about these upstream determinants is with the social determinants of health. And we define this really as the conditions and the environments in which individuals live, in which they go to church, where they go to work. It's really like what is the environment in which people are spending all of their time? And this is what determines whether someone has a barrier to prevent them from falling into the river or to enjoying that view with safety. And so we can talk about things like clean air or clean water, having a stable job that pays a living wage, having a house to go home to and not being under threat of eviction all the time. These are some social determinants of an individual's health. So as we turn to thinking about this from our community, we actually have a community health improvement plan. It was finalized in 2019, and it was based on a community health assessment that was completed in 2018. And so the health assessment was multiple components that included a survey of the community, where we get actual resident responses, really systematic data gathering, as well as like town halls for individuals to participate and drive forward what our priorities are for health. And so, as I said, then the CHIP, the health improvement plan, was derived from there. And so these are the 4 priority areas that were determined by the CHIP and are currently being worked on. So the CHIP was finalized in 2019, and it's meant for the years 2020, 21, and 22. Of course, the pandemic had other ideas, and so much of this work has been delayed, and we're just now starting to turn towards it and try to get caught up on what the plans were initially. And I'll talk about these all just very, very briefly. So the first area is with behavioral health, and the main priority there is to decrease our suicide rate here in Shawnee County. Why this is important is that our rate here in our county is higher than both our Kansas and our US rate. Our second priority area is our access to food. And this is a 2-pronged. It's to decrease overall food insecurity, but also to go into very specific areas of our community where there are food deserts. And there's a proper definition of food desert, but you might just think of it as you don't have access close to your home of really good, nutritious food. And if you don't have access, you often will not utilize good, nutritious food. Why it matters here in Shawnee County is that we have quite a lot of individuals who are food insecure, including 1 in 6 children. And we have 9 census tracts, which you can see clustered on the east and north side of Topeka, that have been labeled as food deserts. Our third priority area is substance use. And this again is 2-pronged. It's looking at decreasing the use of youth with alcohol and tobacco products, and also decreasing our overdose deaths. Why we focus on youth? In many ways, well, youth grow up to be adults, and we have high rates of alcohol and smoking in our community. We also have high rates of drug poisoning deaths, which here in Shawnee County, as you can see, the trend has been increasing, and it is higher than the Kansas rate. And finally, health equity. And I put one example here of why health equity matters. So this graph is showing infant mortality rate here in Shawnee County. The top bar is Black and African American infants, and the third bar down is white infants. And you can see that the infant mortality for Black children is more than twice white children in Shawnee County. So this is why, I guess, just a pretty stark example of why it's important to think about health equity, because for white individuals, we may not be as concerned about this as how it's impacting our Black and African American community. Okay, so the CHA and the CHIP were done before the pandemic. How are the social determinants of health, how has our community been impacted by COVID? Much of that remains a question mark, and it's going to take several years before we've gathered all of the data and can really analyze it. But there's been some research that's happened over the last year. There's been some surveys and data collection that gives us some idea of what we might expect as we move forward. We know that people were not going to their doctor the way that they had been before. And as recently as this spring, about 1/5 of adults who participated in a survey said that they were still delaying care because of the pandemic just a few months ago. We also know that our uninsured rate in Kansas increased by a few percentage points and is now about 16% when we last looked at it. We also know that we had a significant spike in unemployment. Fortunately, here in Shawnee County, we are actually back as recently as March. We were back to our pre-pandemic unemployment level, but for a bit, it had spiked up into the 12%. And a third of adults in Kansas had reported that they expected some loss of income in 2020 for their households. We know that many households are living on the margins and really don't have any ability to weather that without some consequences. Some of those consequences being food and housing insecurity. So the organization Feeding America estimated that our food insufficiency here in Shawnee County increased by several percentage points and is now at 14%, which I didn't include on the slide, but that is higher than the Kansas estimate of 11%. We also know that housing is at risk. 1/3 this spring reported they were at risk for eviction. We know that prior to the pandemic, Shawnee County had higher rates of eviction than both the state and national level, with an average about 3 household evictions every day. And that is from Princeton's eviction lab. That's where that data comes from. We also know the moratorium is gone, so we may start to see evictions rise over the next few months. Mental health took a hit, of course, over this last year. Nearly half of US adults reported some symptoms of anxiety or depression. What's interesting is that suicide deaths actually decreased, and that was not exactly what we expected. And I will be very interested to see what the data is here in Shawnee County. We will be getting some of that mortality data next month in July, and we'll be able to start looking at that. We also know that health behaviors, certain health behaviors worsened. So alcohol and cigarette sales went up, people were reporting more binge drinking, and the quit line calls decreased significantly. So people were basically deciding it's not the time to try to quit now and continue to smoke. Okay, that was all kind of tough, right? To think about some of those effects. This is where I just talked briefly about COVID. Good news. So when we look at our individuals who are eligible to be vaccinated, so that's 12-year-olds and over half of them now have received at least their first dose. And that's really, really wonderful. It's good news. We are still ahead in our county. We are still ahead of the state rate for vaccinations. We are starting to fall behind the national rate as other individuals in the rest of the country are vaccinating more quickly now than we are. As we look forward, we really had a nice decline in our cases, but then we sort of hit a level and we've plateaued, and we've really just been at this plateau, and we expect to see that ongoing low level of transmission through the summer. And we will not be surprised if in the fall we start to see some spikes again. We expect that most of those will be in our unvaccinated sort of pockets of individuals who likely will self-select into that. We may see certain like churches or schools or families that have more cases than others. And so it's, and really so much of it depends on individuals' decisions to be vaccinated this summer. So it's kind of hard to truly predict what the fall is going to look like because so much remains unknown. A couple good news points here. The data is really indicating that fully vaccinated individuals are quite well protected. They're protected for themselves, but also the data is indicating that they are not very likely to pass on an infection. If they themselves were to become infected, they're unlikely to pass it on to somebody else. And so, as I'm sure everyone is aware, the CDC modified their guidelines and said you can feel safe not wearing your mask when you are out and about in public now, if you are fully vaccinated. And one thing I do want to make clear is that that doesn't mean that you won't get infected. The vaccines are not 100% effective, as many of you, I know you guys know this. But if you do, it's likely to be a mild infection. Booster shots are something that everyone likes to ask us about. And I think the question continues to remain unknown at this point. Much depends in fact on the variants, and then just as we do ongoing studies to figure that out. Another happy point is that transmission rarely occurs outdoors. We had been wearing masks both inside and outside. Most of the research now indicates that you are unlikely to spread from one person to another when you're outside. The ventilation aspect is really quite helpful. So we have made the decision here in Shawnee County that you can be outside without masks, you can be close to each other, and we will not put you into quarantine. And I think I have one more. I looked at what the Rotary Club does and the causes that you champion. And I would say, even if you call yourself a service organization, I call you a public health service organization, because truly all of the causes that you are working towards, we can find how they connect back to the social determinants of health. And so I just want to say thank you for that. I think this is a wonderful organization. If you are interested in participating in some aspect of our health improvement plan as we move forward, I have some contact information here, but it's the health department, of course, and our Heartland Healthy Neighborhoods who are really leading that charge. So we'd love to have you join us. And that's it. Thank you. Question time? Okay. Repeat the question. Okay.
Question I have is like such a great amount of what the vaccine is. I was talking to a gentleman yesterday who said he's quite sure that everyone who has received the vaccine will be dead in a year and a half because of taking the vaccine. And I see television advertisements saying get tested. The implication is get tested, now you can go out in the community. Like, where are all the ads for getting the vaccine and spreading some useful information about it?
Ooh, so where, yeah. Right, repeat the question. I almost just went right into the answer. So the basically you're seeing a lot of misinformation and you're hearing a lot of misinformation, but we don't have the factual arguments out there is what I'm hearing. You know, I really don't have a good answer for that. I think as much publicity as we can give towards true and factual commercials and so on, the better. I know we've done some commercials here in Shawnee County, particularly around our health equity, but I'm hearing you when you say we could do more.
I've heard media reports recently that there's been a spike in opioid deaths. And is that because it's more available? Is that because people are stressed because of the pandemic, or do we even have a theory as to
So the spike in opioid deaths. Yeah, the drug overdose deaths, I did have that on my slide. I don't think I touched on it. Did appear to increase by about 30% nationwide last year. And I think that the theory gathering is still kind of out there as to why that happened. I suspect that it may have had something to do with the delayed medical care and not getting in to see the provider, as well as potentially some mental health aspect of it that we can't predict or that we can't say for sure.
Was not doing as well as for the country. Are there some generalities about our community that we aren't doing as well as we could?
And with vaccine administration or with COVID cases? Oh, okay. Oh, I see. Oh, I see what I'm talking about that. Okay, so sort of what the generalities are for why we don't do as well with our indicators. And I'm looking at Dr. Pizzino with his subject matter expert on this. I think we do have a pretty high social vulnerability here in Shawnee County. We have very particular areas where if you rank your vulnerability from 0 to 1, with 1 being the highest. We have communities that are 0.98 with their vulnerability. And so as long as we have that sort of vulnerability, as long as we have significant inequality between one side of our community versus the other, we often will see us not doing as well on some of the highest sort of health indicators. I don't know if that answers your question or not.
Well, what are things that community, we as citizens, can do to impact that?
I think that probably what I would encourage us to do is to get involved with our CHIP, with our health improvement plan. That has looked at those indicators, has looked at what the needs of the community that people are actually saying and what they need. And that's how we've determined the direction and the actions that need to be taken. Now, of course, that's reviewed every 3 years. And so it may be that after the pandemic, we will decide that we have other indicators that we really need to look at. But I think that if you're someone who lives here and you want to make a difference on our health, joining that would be the best way to sort of focus all of our resources and our efforts in the same direction.
One of the things that I struggle with, yeah, I live outside of Topeka and I go to Topeka and Lawrence frequently. And they all have different, the rules are so fragmented. Is there effort on public health officials to make that information more available? And if so, where do I go to find that information?
And so speaking about like the masks,
Mask
example,
orders,
or,
yeah, right. Gathering sizes, all those kinds of things.
Yeah.
Are so fragmented, and I don't want to disparage my county, but Jefferson County is particularly hard to find out. You have to go to the commission minutes to find out what's the latest rule is.
Oh, you have really identified what, oh, sorry. So the question was asking about just how every county is different, and what can you do, where can you find the rules basically, or the recommendations. Oh, you have identified, I think, the fundamental challenge that we have had for this pandemic. Years leading up to it, we were really separating public health out from like our clinical health systems. You know, we were really, they need to be intermeshed, and we were not doing that. Hospitals not necessarily talking to the health departments and so on. We were also underfunding and understaffing our health systems, and in public health in particular. And we have a very decentralized public health system in our country. We tend to think of the CDC and then our state and then our local, but the truth is that they're pretty much separate. And so there's not like a way of communicating easily from the CDC all the way down, not a way of communicating easily between, as I said, the health systems and public health. And then particularly here in Kansas, it became even more fragmented as the efforts to make sort of statewide recommendations or executive orders were changed to putting that down to the county commissioner level, the county level. And it was at that point that really the breakdown like really started to happen. It was at the moment when we all needed to sort of come together that it became fragmented, and that's what happened basically, that Douglas County is going to have something different than Shawnee County, and in part because of the previous decentralization. Every local health department has a different website and a different setup and a different way that they communicate, and their relationship with their commissioners is different, and it is. I'm just kind of talking now that you've identified the challenge, basically. And so for Shawnee County, we do our best to put the recommendations on our Shawnee County Health Department website. And there are 4 banners at the top, which try to put, there's a banner for vaccines. You can click there, you can go to our vaccine page. There's another for like FAQs and information. We put the health orders, we put our isolation and quarantine orders, we put our fact sheets there. We have a dashboard as well. Previously, when we were publishing our indicator, our weekly indicator, it would be on there as well. And so for here in Shawnee County, if you're interested, we would also put the resolutions too. So the commissioners, if they would make a resolution that would change a health order, it would also go on our website. I have also struggled as I have looked at other counties and to see what they're doing, to see what they're doing with their health orders. I've also had to kind of dig and search around to find that.
On the follow-up from the Zoom, what do you think about legislative bodies passing laws giving control of public health messages to the legislature instead of governor and local health officials?
Oh, that's a charged question.
It wasn't my question.
Okay, so the question is, what do I think about the movement? Say that again for me. Local, yes. Okay, I guess it's on Zoom so they can see the question. Yeah, I think I have to, I need to be a bit cautious about how I respond to this, but I think it was a bit difficult to make a change like that mid-pandemic. And I think it was potentially a bit reactionary and does not necessarily look forward to the next health emergency and the next pandemic. And I think there is a reason why Kansas has had so many health officials and administrators and individuals working in public health leave. And Kansas stands alone in that. I don't know how many individuals are aware of that, but I think Oklahoma had 1 person leave. I think Nebraska had 0, something like that. We've had like 30 some people leave. So I think there's that contributed to it, and it continued to further like fragmentize our response and really changed the social determinants of health for Kansas when you make a decision like that. So trying to be careful with my answer there, to be honest. Mm-hmm.
And I'm curious if is it or when or like
Oh gosh, yeah, great question. If or when on pandemic, and what can we do better next time? I think it's a win. I can't say for sure just when it will be, but I think that it will likely be, the last one was like 100 years ago. I think it's going to be less than that. We are creating the conditions in our world for pandemics to develop. So we do need to be ready for that. And at least our expectation is that it could happen again. As far as what we can do differently, this is our opportunity now to identify what went well and what went wrong. And really our opportunity to build public health to the infrastructure and the support to really make it able to respond quickly the next time. We do not need a fragmented healthcare system where at every county in the United States, someone's doing something a little different. There's some, there needs to be some flexibility because every community is different and you can't apply something up here all the way down here. But we need to be able to communicate. We need to have the infrastructure in place for just very basic things like contact tracing, for being able to upload test results and then be able to pull that down. I don't know how many people are familiar with the struggle Shawnee County has with actually just identifying who is positive every day. There are like a lot that's gone on behind the scenes that I think individuals don't realize. So really we need to understand what public health is and does, and we need to support it and get it ready for the next time. Now, on a side note, the healthier a community is, the more likely they are to withstand a pandemic. So we have seen that play out here in the United States, that individuals who already suffer from health inequities were the very individuals who were dying at the highest rates. And so one of the ways that we can prepare ourselves for future public health emergencies is by improving our health equity and our health across the board. And so those are kind of like at least two changes that we need to make before the next one comes. Yes. Yeah, you want to come on up here? Yeah, they get past and present. This is great.
I agree with everything you said, but one additional thing of that we should do as a community, let's pay attention to what public health is doing and saying. We, people who are working in public health, have been warning for decades, literally decades. I have presentations that go back 25 years ago, where I was saying there is a pandemic. I can't tell you what it's going to be, where it's going to start, and when, but it's got, and now we pay attention. When the pandemic came, then people were going up and on pretending they never heard and say, oh, who could have known? Here are the people who didn't know. But if we only pay attention after the emergency starts, it's too late. So that's maybe one lesson. If we had paid more attention and been more careful 10, 15, 20 years ago, perhaps things would have been a little easier now.
Hopefully this is the wrap-up question on those various recent questions. Could you talk just a little more about the roles and relationships between the health officer, the health department, and Heartland Healthy Neighborhoods? And related to that is how people could best, if they want to stay current on what's happening or have input on what's happening or help, where do they plug in?
Yeah, thank you. That's a great question. So the relationship between the health officer, the health department, and Heartland Healthy Neighborhoods. Okay, the health department, as I had mentioned, is a department in the county. It has its own hierarchy. So it's got the director and it's got the division managers and so on. I'm sort of, the health officer sort of floats out here on the side of the health department, and I answer to the commissioners. And so I'm contracted by them and contracted to work in association with the health department. It's my medical license that the health department sort of operates under. And I am provided, I provide all sorts of like medical advice for decisions that are made for the health department. Heartland Healthy Neighborhoods is really right now kind of our action arm for implementing our health improvement plan. So they're not technically within the health department hierarchy either, but that's really where the work is being conducted for our health improvement plan. So if you would like to get involved or have input, the Heartland Healthy Neighborhoods chair is Brett Martin. Some of you may know him from United Way. He's the chair, and you can actually email him if you'd like to get involved in any one of these aspects. Craig Barnes is our community health, what is it? It's CHOP. I'm forgetting what, he's a division manager who works in this area. And he's also really pleased to hear feedback and individuals getting involved. You can email me too. It's just erin.locke@snicco.us. And because I'm involved in this as well, I'm just sort of floating out here, getting involved where I can. Is that an answer to your question?
Well, I think it points out that it's confusing.
Yes.
If you're also on the board of the health department.
Yes, the chair, the commissioners. Yeah.
Well, but the department itself has board of directors.
I am not familiar with the board of directors. Yes. Yeah.
Back when we had the Federal Qualified Health Center under the health department, there was a board for the clinic. But that's how Grace met, and they spun that off. So we don't, the health department no longer has a board. So just to clarify, if they want to plug in, they can email, because this, I think you have a lot of interest here, email you directly or Craig. Or whoever else that.
Yeah, Brett Martin.
Or Brett. And then Heartland Healthy Neighborhoods meets once a month. plug in, and it actually has some subdivisions.
Yes, and I did not get into that, but I put the link in here, but if you just Google like Shawnee County CHIP, it should pull up the most recent health improvement plan, and you can see sort of the different areas that people are working in, like community gardens, and just I think there's something for everyone with
They
it.
were involved in collecting, helping get the data collected.
Mhm.
As well as.
Yeah.
I just wanted to-
Yeah, and we would love to have you. That's the more people we have working on this together, the sooner we're going to, excuse me, the sooner we're going to actually accomplish our goals and find new ones to go after. So. Okay. Get out of here.
Thank you, Dr. Locke. Great information. Enjoyed the presentation. And a couple things. Next week's presentation will be by Russ Cobb, our club member, and it's going to be about Evergy. And it is our longtime practice. We donate a book to Ross Elementary School to commemorate your presentation, and we have a signature line on the book plate, so we'll ask you to sign that before you get out of here. So thank you for that, and thank you for the presentation. I think that'll do it. Let's stand and do the four-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? And will it be fun and kind? And by the way, we'd love to have you as a member. Thank you, everybody.